Let's talk about 4 steps that you can take to reduce the risk of a concussion, or at least reduce the dangers that come with suffering a concussion. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of That's Gotta Hurt, The Injuries That Changed Sports Forever. And I provide education, information, and commentary on sports and exercise, injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. Concussions are very, very serious injuries. I've talked about them on my podcast and in these videos for a long time. But what I want to talk about is, if you suffer a concussion, what can you do to lessen the risks or the dangers that come of that? So let me give you 4. First of all, as a young athlete, we'll talk about high school and college athletes especially, you need to know the symptoms of a concussion so that you could potentially know that you might have suffered a concussion. Yeah, you can have a headache, but it's not just a headache or loss of consciousness. It could be dizziness. It could be blurry vision. It could be sensitivity to light. It could be difficulty with balance. It could be nausea or even vomiting. Any of that could represent a concussion, which then would lead to the second thing I'm going to tell you is, if you have any of those symptoms, go tell somebody. And if you're a parent, emphasize to your kids that they need to tell somebody that they suffered an injury. Tell the coach. Tell, hopefully there's an athletic trainer there or a team physician there so that you can get checked out. Don't try to stay in the game and hide it and play through it. We know that doesn't just happen at the NFL level. We know that young kids do it as well. And that's very dangerous. If you suffer a second blow to the head before your brain has gotten back to normal, you can get what's called second impact syndrome, which is a much, much more serious brain injury. People can die from that, actually. So you've got to let somebody know so that you can be evaluated. The third thing is to get evaluated by somebody that's very well trained in concussions. On the field, let the athletic trainer or the team doctor or both examine you, but then potentially go get seen by maybe a neurologist that specializes in concussions. Yes, you may go to an urgent care or to an emergency room just to make sure there's not a serious head bleed or something like that, especially an emergency room, but you need to be followed by somebody that does this and knows the latest research. So again, maybe you find a primary care sports medicine physician, or again, a neurologist that deals a lot with sports-related concussions. And my 4th tip really is related to now return to sports, return to activity. This is where going to see a specialist that knows a lot about this is so important. Yes, there's a process for evaluating somebody, knowing that all their symptoms have gone away, maybe use some of the fancy neurocognitive tests to determine when the brain's gotten back to normal. But you need to know, is it safe to study and go to school and be in lighted areas, watching TV, things like that. When is it safe to exercise? And then yes, ultimately, when is it safe to practice and play sports? Those are my 4 suggestions to minimize the dangers that come from concussions. So if you're a parent, understand these tips, talk to your kids before sports start this fall so that you can hopefully minimize the dangers to them. Okay, what do you think? Do you have any other tips to share about concussions, be it specialists or evaluation or symptoms or something I didn't even mention? Below this video, share your thoughts. I'd love to read them, and I bet people watching this video from all over the country and all over the world would love to read them as well. If you like videos like this and you want more information on sports and exercise, injuries, injury treatments, injury prevention, subscribe to my YouTube channel. Click the button in the upper right corner of the page. I record a couple of these videos every single week, and they'll get delivered directly to you. Thank you so much for watching. I hope this was helpful. Share your thoughts on minimizing the dangers of concussion, and I look forward to seeing you right here next time.